Welcome to Vital100 Wellness with Dr. Bob, the podcast designed to take your health to the next level.
Hello, Dr. Bob Johnson here on another podcast. My channel here is Optimal Health Wellness. We go over so many things as it relates to overall health and what are the most important issues that affect the average person in day-to-day activity. As we all know, our most important asset in our life is our health. Without it, it doesn't matter how much money you have, it doesn't matter how much opportunity or how much knowledge. If you don't have your health, you really don't have anything. And so it's important to be healthy. Now, we've talked about many things. We've talked about nutrition, we've talked about exercise, sleep. But really, the thing that health comes down to, the most important thing, is getting enough oxygen into our system. Now, oxygen is important for many things. You certainly, if you're not getting oxygen, you cannot survive more than about 7 or 8 minutes. And if you are deprived of oxygen, whether you're under the water or for whatever reason, for any longer, you will have brain damage, and further deprived of oxygen, you won't have pretty much a life to be around. So oxygen is very important. Now, one thing they monitor during surgeries is the pulse oximeter, which tells the saturation of oxygen into the system. And they like to keep it at about 98, 99%. But really, that's not a very accurate assessment of your oxygen levels. I get, with my patients, I see a lot of what's called hypoxia. Hypoxia meaning low oxygen. Now, oxygen is very important. First of all, with more and more pollutants in the air, our oxygen in the atmosphere is decreasing. So we are not only starting behind the barrel, but we're really depriving ourselves right from the beginning of oxygen. So what does oxygen do? It is important for the body, every cell, to be able to use oxygen to make the energy and to perform the vital functions which each cell is intended to do. So without oxygen, you are not going to go very far. As I said, it's the most important, by far and away, the most important nutrient that we have. Now, there are other nutrients that are absolutely critical, but oxygen is a must. Now, let's go over the whole process of getting oxygen into your system. Let's assume, first of all, that you have a decent oxygen level in the atmosphere. We breathe in the air and we transport it into the lungs, which converts it through the lung membranes. We call them the little sacs for oxygen or for air, the alveoli, and gets it into the red blood cells. So, first of all, you have to have a free passage. If you have nasal blockage, if you have blockage of oxygen through the mouth, what happens is you're going to get a lower oxygen level. One example of this is snoring, or if someone has sleep apnea, they're not getting enough oxygen into their system. If someone is snoring, it means that their lower jaw is blocking off their airway and you're forcing air back and forth, which vibrates the tissue at the back of the throat. That is what snoring is. But sleep apnea and or snoring, which I ask my patients all the time, do they do that? Do they know, do they have someone who identifies that? They need to get something to open up the airways when they're sleeping. A way to identify is if you wake up in the morning and you're very tired, it usually is because you're not getting enough oxygen. That's an indication of how important oxygen actually is. So first of all, there's the blockage. The air gets into what we call the trachea, which travels from the mouth and the nasal passages down to the bronchi and the lungs. If someone has swallowed something and they can't breathe, you can see them being very, very distressed. And you need to get that blockage out. That's where the Heimlich maneuver comes in to get that blockage so that we can breathe and not have the blockage of oxygen getting into the system. Okay, so the oxygen gets into the bronchi and into the lungs. The sacs in the lungs are called the alveoli. And what they do is they are the sacs where the oxygen is. And it's interesting because the oxygen travels across the membrane and is picked up by the red blood cells. Now, many of my clients have some problems with the alveoli. You can get toxicity in the alveoli, smoke from the air. We recently had smoke pollution because of the wildfires up in Canada and northern US. And so those oxygen, the levels go down because the alveoli are toxic. They've been poisoned, and they don't transport the oxygen very well into the through the alveoli membrane and into the red blood cells. The other thing that causes the alveoli not to function so well is infection. I see this all the time. I just had someone today, they had chlamydia in their lungs. You could breathe something in, you could get pneumonia. Single pneumonia is one lung, double pneumonia is two lungs. You can get a number of different infections, mycoplasma, mycotoxins from mold. Those kind of things are something we can inhale in. And so toxicity and or infections are what can really compromise the alveoli from getting oxygen from the air across the membrane into the red blood cells. Now, you need to detoxify, you need to pull those toxins out if indeed it is a toxicity, and prevent any further toxins from getting into the lungs. If it's an infection, you need to go after those infecting microorganisms. I personally take care of the different microbes, infecting microbes in the lungs with a homeopathic series. Many people will think that they need an antibiotic. Some are effective, some are not effective, and they're not as specific as a homeopathic series if you can identify the infecting microorganism. Now, to kill the infections, to remove the toxins, allow the lungs and alveoli to be able to process the oxygen. I almost forgot the other toxicity source is that of smoking. People who get addicted to smoking have much shorter lives. And it really comes down to they get the toxins throughout the body, but mainly in the lungs. And the lungs get very compromised. They get damaged, and they're not able to process oxygen. From there, you feel exhausted. You get chronic illness because oxygen is the thing that may impede any chronic illness. So important to understand that. An interesting thing that is done is ozone. Ozone is concentrated oxygen. Ozone kills microbes. Ozone is 3 atoms of oxygen as opposed to environmental O2. And so what's interesting is O3, ozone, can kill a host of different microbes. You can use it on the skin. You can have it penetrate the skin, get into the liver. You can get into different areas that might be infected. Ozone is amazing. It can be injected IV and circulate throughout the body. It's amazing. What's interesting is if someone breathes in ozone, it gets into the lungs and irritates them. The lung tissue is the only tissue in the body that cannot handle the ozone. And so it does irritate. And sometimes, like when there's more ozone in the environment, it is very irritating to the lungs. So oxygen, O2, gets into the alveoli. The alveoli, it moves across the alveolar membranes, and what's waiting right there in the lungs are blood cells, red blood cells. Red blood cells are very important because they bind oxygen and transport it to the rest of the body. So you can see if there's not enough oxygen getting across the lung membranes, if there's toxicity, if there's infections, if you're not getting in enough oxygen, you can see that the red blood cells are not able to bind with enough oxygen and get them to the cells, and the cells stop functioning for the most part. They'll continue to function on a much lower level. So what's in the red blood cells is very important. And you'll hear a term called iron deficiency anemia. Anemia takes many different forms depending on the quality of the blood cells. Sickle cell anemia is where the red blood cells are misformed and don't transport enough oxygen or don't pick up enough oxygen. If people are iron deficient, the iron is in the red blood cells in a molecule called heme, and what it does is the iron is necessary to pick up, bind oxygen, and help the red blood cell transport it to the rest of the body. So if one is not getting enough oxygen, it could be iron deficiency. Other problems with red blood cells are they're too big, they're too small, they are not transporting or not getting good circulation to the different cells of the body. These are all problems of getting, even though the oxygen is transported across the lung membranes to the red blood cells, maybe the quality of the red blood cells is not working. And so what will happen there is you won't get enough oxygen being transported to the cells. So as you can see, there are many steps along the way that can interfere with getting oxygen to where it needs to be, the cells, from blockages in the nasal passages or the oral cavity, blockages in the passages into the lungs, blockages in the lung membranes or the alveoli. And what happens is all these things translate to not getting enough oxygen to the red blood cells. So very important to be able to pinpoint exactly where the blockage is, where you're not getting enough oxygen. Is it you're not taking it in? Is it not getting enough to the lungs? Is it not getting enough into the red blood cells? Are the blood cells not binding enough oxygen to be able to fully transmit or transport the oxygen to all the cells of the body? So very important to understand that. Now, what's really critical is that the tissues that need the most oxygen are the brain cells. The brain cells are very important. So lacking or having anemia, lacking blood cell transport of oxygen profoundly affects the brain. And so it's important to understand how to get oxygen into the brain. The other tissue that's very important, and everybody can realize this, is when you are exercising and you get very sore legs, muscles. The exercising muscles need a huge amount of oxygen as well. And if you're not trained well enough, if you're not getting the lactic acid, which is formed in the muscles, out, then your muscles are going to be very sore, and you may, after a new athletic event, maybe you've just run a race and your muscles are sore the next day, you're building up lactic acid. That's an indication you don't have enough oxygen into your system to bind it. And when you train athletically, and you are able to exercise more competitively, and you don't have the buildup of lactic acid, you're better trained because the oxygen gets to the muscles and doesn't form the toxic compounds, the lactic acid, that indicate that you're not as in good shape as you could. So it's important to be able to understand getting that oxygen to these tissues, the brain cells, the lung cells, the liver cells, the muscles are all absolutely critical. So what can you do on a regular basis? First of all, you can do deep breathing exercises on a regular basis. You can breathe. It's better to breathe. Close your mouth, and 3 or 4 times during the day, breathe in deeply through the nose. That helps a lot in being able to get enough oxygen in. So deep breathing is going to be very important. Having enough iron in the red blood cells is critical so that you transport enough oxygen. Making sure you don't snore or you don't have sleep apnea. Exercise is absolutely critical because it trains blood cells to be able to transport more oxygen. A very interesting little study of people is in studying people who live at altitude or train at altitude. And what it does is, as you go into altitude, you don't have as much oxygen. When you don't have as much oxygen, the red blood cells adapt to that, and they are able to, sooner or later, with training at altitude or mountain climbing to high altitudes, it helps the red blood cells and the lungs be able to adapt to that lesser oxygen. So when you come down to sea level, when you get more oxygen in, like in a hyperbaric chamber, then you are able to transport more oxygen to the cells and perform at a much higher level. So there are a number of things you can do, whether it's taking certain supplements, doing exercises to train your muscles in your body to transport oxygen better, to be able to get a stronger heart so it pumps at a better rate to the rest of the body. Incidentally, low blood pressure is problematic as well as high blood pressure. Low blood pressure means the heart is not pumping enough oxygen to the brain, to the fingers, to the toes, to the genital areas. And so very important to have the heart functioning. Taking your deep breaths, being able to make sure the lungs are not toxic or infected. And this will help so many areas of the body be healthier. You'll be able to perform better. You'll feel better. You'll have more energy. So always remember that oxygen is your most important nutrient. And I want you to always remember to enjoy the journey.
Thank you for joining us on this episode of Vital 100 Wellness with Dr. Bob. Be sure to visit our website at Vital100Wellness.com for more ways to listen and to explore additional health resources. If you have any questions for Dr. Bob or feedback and suggestions for the podcast, you can email us at info@Vital100Wellness.com.